co-founder of Infosys, chairperson as well, Mr. Nandan Nilekani, recently made a comment that India has achieved what it would have achieved in 47 years in now 9 years. He said that digital infrastructure is helping India uh, at faster rate to achieve growth and even solve the big society problems that our country faces. I have no doubt that next few years, decades are something we are not able to imagine, but they are going to be phenomenal. So what happens with the elderly population? Since I'm here to talk about dementia, the elderly population is most affected by this disease. Is by 2030, we are expected to have elderly population of 192 million. And by 2050, you won't believe every fifth person in India is going to be elderly person. I mean, that's a good news, right? We are living longer. Yes, definitely. But then what? One in three person, one in three is lonely. They're experiencing isolation, which is giving rise to mental health issues, depression, anxiety. 30% of elderly population tends to have some kind of cognitive impairment, which can be mild in nature, like mild cognitive impairment, but can also be very severe, something like dementia. So how are we going to tackle this silver tsunami? How are we going to ensure that our elderly get timely diagnosis for diseases like dementia? How are we going to ensure that the family caregivers of these elderly have access to information, access to services that are good for the care? How are we going to tackle the issue of unpaid care? And more importantly, how do we ensure equality in unpaid care, especially because women are usually burdened with that? And this is, in fact, a root cause for women's economic and social disempowerment. Today is 1st September, which is beginning of World Alzheimer's Month, a month devoted to create awareness about the Alzheimer's disease. Diagnosis is extremely important in this disease, which is currently most of the time not accurate and takes a while for a medical professional to give a diagnosis of dementia. Of course, a lot of elderly we meet with have stigma that they have to go to a neurologist or a psychiatrist, but we also see a fear of them when they are told to go through MRI, CT scans, they do not want to go through that. So when recently Sundar Pichai made a comment that simple eye scan can replace MRI and CT scan, I'm hopeful that our elderly also has access to that. Assistive technology can be extremely helpful to keep our elderly more independent, especially when they are in early stages of dementia. So something like if the gas is kept turned on, or if the bath water is too hot that they could get burnt, right? So all of this could be handled with equipments which have auto switch off, or some way caregivers can monitor what the elderly are doing at home. False sensors could be extremely helpful. Another big issue is quality of life. If I say 2 minutes, what do you think? You will say 2 minutes is something you do very quickly. 2 minutes mein call karke aaya, or sometimes even Maggie, right? But there was extremely shocking research in UK care homes, which was done with people with dementia, and they saw that 2 minutes was of the social interaction elderly person with dementia got in a day. That included talking, hi, hello, can I go to the bathroom, can you give me some food? So staff shortage is there even in India. We do trainings and we see people do not want to come for fully sponsored training with a guaranteed job because care is not glamorous. So I have no doubt going ahead we will have robots helping with personal care, changing diapers of elderly. They will also give stimulation in the sense entertaining elderly, playing their favorite music. And most importantly, last and not the least, the technology for caregivers. They need data to track the elderly, especially family caregivers, and health monitoring. Also education, extremely important fact to empower caregivers. If augmented reality, virtual reality could be used to give them empathetic point of view of people with dementia. With this, these are my recommendations for dementia and technology. I hope we progress. Our tech-savvy India will help people with dementia, their caregivers, and professionals working with them. Thank you.